Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on e-media.
Buenos dias, Zamboanga. Welcome sa PIA Kapihan na Zamboanga sa SM City Mindpro. Hatid ng Philippine Information Agency, Mindanao Communicators Network, SM City Mindpro, MCTV, and eMedia. We are live po via PIA Western Mindanao Facebook page and other government agencies' Facebook pages, via PRO9 Facebook page, the Northern News Flash, 1 TV Philippines, Isa TV Channel 17, and PCH Cable TV, and of course via cable televisions in Zamboanga City at MCTV and eMedia. Happy Kapihan po sa lahat nating mga viewers. Ang Kapihan na Zamboanga will discuss important topics that will help you make more informed decisions wherever you are. Ngayon po sa buwan ng Setyembre ay ginugunita po natin ang ating Generics Awareness Month, no? So makakasama po natin from Department of Health po ang ating panauhin ngayong araw. We have the pharmacist po from DOH9. We have Sir Michael Jumawak. Welcome po sa ating program.
Ayon, so thank you so much. Thank you so much for having me. Good morning, everyone.
Magandang araw po. It's nice po to have you here with us sa ating programa. Like I mentioned po, yung ating pag-uusapan is about the Generics Awareness Month. So ano po ba ito? What is the significance of celebrating this or observing this? Yung pagkandak po natin ng ganitong activity, and why is it important for the public to be informed about generic medicines?
Ayon, so every month of September, we celebrate the passing of the RA number 6675, or also known as the Generic Act of 1988. So this important law promotes the use of generic medicines, making it easier for everyone to access affordable and effective treatments. So it is a great reminder for how we're making healthcare more accessible for everyone. And additionally, it aims to raise awareness of the benefits of the use of the generic drugs, from its affordability, effectiveness, availability, and safety. It gives the public an informed choice when it comes to their healthcare and empower individuals to take advantage of the cost-saving opportunities offered by generic medications while ensuring their safety and quality.
Sir, ano po ba yung kahalagahan po, no? Yung paano po natin may ensure, especially for the DOH, the quality of the quality and safety of the generic medicines po in the market?
Alright, so the Department of Health, or DOH, ensures the generic medicines are both safe and effective with the help of the Food and Drug Administration, or FDA. So the FDA checks all the medicines, including generics, to make sure they meet the high standards for quality and safety before they hit the shelves, including community, hospitals, or any health facilities. So when you pick up any generic medicines, you can be confident that it's been thoroughly tested and approved to work just as well as the branded versions.
So, like you mentioned po, no, na yun nga, compared to the branded po na mga medicines, it still works po. It also works. But ano po yung mga common misconceptions about generic medicines, and how do you as in DOH address this concern?
Alright, so first of all, yung number one siguro na misconception ng mga tao is that when you say medicine kasi, medicine itself, lahat ng medicine meron talagang generics. So a lot of people think that generic medicines are not as safe as the high quality or branded drugs, or that they might not be safe or could take longer to work. But that is actually a misconception. Generic medicines have the same active ingredients as their branded counterparts and must meet the same strict standards for safety, quality, and effectiveness by the FDA. The Department of Health, on the other hand, is actively addressing these misconceptions by educating the public about the benefits of reliability of generic medicines. So through information campaigns, the DOH emphasizes the generic medicines are thoroughly tested by the FDA to ensure they work just as well as the branded medicines.
So, you mentioned po, no, yung kahalagahan, o yung ano rin po, yung about the generic medicines, yung mga misconceptions, and paano po ginagawa ng Department of Health to, advocate din yung ating mga public, the residents, na these are also effective. So, can you explain po ba, ano po ba yung difference ng generic and branded medicines in terms of efficacy, safety, and cost?
All right, so when you say generic and branded medicines, they are similar in many ways. But if yung pagkakaibahan naman, well, when you say efficacy, both types have the same active ingredients. That's a fact. So they work the same way in your body to treat conditions. The main difference might just be the name or how they look, or they provide the same benefits. And secondly, for the safety, generic medicines are just safe as the branded ones. Before they can be sold, they must pass the strict tests from the FDA, and this ensures that these medicines are safe to use and same quality as the branded ones. And lastly, for the costs, the main difference between the generic and brand names medicines is the cost. Generic medicines are usually much cheaper because the companies don't have spend so much money on research, development, or any advertising, kaya yung nakikita natin sa TV or sa radio. So this lower cost make generic medicines a more affordable option for many people. So in summary, generic medicines are just as effective and safe as branded ones, but they cost less.
We really can't avoid po yung mga misconceptions na because the medicines are cheap, ay baka hindi na siya effective. May mga ganun talagang misconception na dahil mura lang siya, baka less yung effect niya compared to the branded ones. So ano po yung mga initiatives or programs po ni DOH implemented to promote the use of ating mga generic medicines among healthcare providers and to the public?
Alright, so for DOH naman po, the Department of Health aims to promote generic drugs in both public and private sectors in accordance with applicable national policies. So ito po yung Generic Act of 1988, which we are celebrating this month for the month of September, and the Cheaper Medicines Act of 2008. So it tends to improve compliance to treatment, reduce out-of-pocket spending for medicines, and of course to provide quality and affordable choices to expensive branded counterparts. And of course, the Department of Health as well, meron po tayong tinatawag na Medical Assistance for Indigent Patient Program or MAIPP. So this program is intended to provide indigent and financially incapacitated patients seeking consultation, rehabilitation, examination, or other confined in government hospitals with medical assistance.
So talagang napakalaking tipid po yung magagawa po when you buy the generic medicine compared to the branded ones. So paano po how does DOH or how does the DOH work po with pharmaceutical companies natin and healthcare professionals to increase po yung availability naman and accessibility of our generic medicines?
Yun, so it's actually a good news for everyone since right now marami na tayong mga kumpanya na they are actually manufacturing generic lines of medicine. So the Department of Health in the Philippines works with pharmaceutical companies as well and healthcare professionals to increase the availability and accessibility of generic medicines through variety of strategies. So the DOH published the Essential Drug List or EDL that includes a list of essential medicines that are considered crucial for public health. This list is used as a guide for the government in procurement and dispensing, of course, of medicine. It also ensures that generic medicines are included in government procurement processes, encouraging their use in public health facilities and to improve the distribution of generic medicines in remote areas and underserved communities.
Thank you po. Sir, what role naman po do generic medicines play in the DOH overall strategy to make healthcare more affordable, accessible in the Philippines?
Yes, so I think ito yung pinaka-importante siguro in behalf of DOH. Generic medicines are key part of Department of Health strategy to make healthcare more affordable and accessible in the Philippines. That's a fact. So they provide the same quality and effectiveness as the branded medicine but at lower cost, allowing more Filipinos to access the essential treatment they need. So this approach supports the DOH commitment to Bawat Pilipino Ramdam ang Kalusugan initiative, which is part of the 8th Agenda Action. The goal is to ensure that every Filipino feels the impact of improved healthcare by making essential medicines more available and affordable across the country.
Tama po, Hindi lang dahil sa accessible siya or more cheap nga yung ating mga medicines, but also dapat available din talaga siya always sa market natin kasi baka yun nga, yung demand of our people na nangangailangan po ng generic medicines para ma-comply din natin, no? And how can the public po identify if a medicine is generic and ensure na they are getting the correct medication?
Ayun, so I think isa to talaga sa pinaka-importante talaga as a pharmacist or as a buyer. So well, we must keep in mind that all medicines has its generics. That's a fact talaga. It is usually enclosed inside what we call a generic box. So first, you have to check the label. Generic medicine usually feature the name of the active ingredient, with the name on the packaging rather than the brand name. And of course, the packaging is also state generic or include in a note that it is a generic equivalent. Yun. So pangalawa po is, of course, you have to ask the pharmacist. So as a registered pharmacist myself, I encourage everyone not to be shy by asking questions. Kasi mas okay yung nagtatanong kesa naman magkamali tayo. So we're here to help, and we appreciate it more if nagtatanong po talaga tayo. So pharmacists can confirm whether the medicine is generic and it's the right one prescribed for your condition. And of course, we have to compare the ingredients. Look at the active ingredients listed in the packaging. It should match the active ingredient in the brand name version of the medicine. And of course, yung pinaka-importante, you have to look for the FDA approval. Ensure that medicine is approved by the Food and Drug Administration or FDA. This guarantees that it meets the same safety and effectiveness standard as the brand name version.
Ayan. Thank you po. Actually, i-share ko lang din po, no, sir, na based from experience, na-appreciate din natin na when we go to the pharmacy, bibili tayo ng certain medicine at tinatanong nila tayo, ma'am, would you prefer generic or the branded one? So, at least doon, ako personally, tinatanong ko, how much po ang difference? So, syempre, di ba, you would go to the cheaper talaga yung generic medicine natin.
Yeah.
And then po, so, ano yung mga challenges? So far po yung acceptance po ng ating mga generic medicines. Kumusta po yung acceptance ng public? And how do you face this ano yung mga challenges no, in promoting generic medicines? How do you address po?
Well, actually, nagiging difficult or dilemma siguro to ng mga pharmacists or healthcare providers ngayon. So, when the Department of Health faces challenges in promoting generic medicines, such as public perception that generics are less effective or lower quality compared to the brand name drugs. To address this, the DOH is running educational campaigns, which will be mangyayari po siya sa month ng September all over the peninsula. And to address this, marami po tayong gagawin na educational campaigns to highlight the safety, efficacy, and cost-effectiveness of generics, emphasizing that they meet the same rigorous standards as branded medicines. Additionally, ensuring that all generics adhere to the safety and quality standards involve complex regulatory processes by the FDA. The DOH, through the Food and Drug Administration, addresses this by continuously monitoring and regulating generics and streamlining approval processes to ensure high-quality generics are available.
Like you mentioned po, no, the Generics Awareness Month or yung paggamit po natin ng mga generic medicine is isang batas na siya. So, are there any upcoming policies po, regulations that the DOH plans to introduce po to further support nga yung ating use of generic medicines in the country?
Ayun, so the Department of Health has been actively promoting generics since the enactment of the Generics Act of 1988, as well as promoting consumer choice through drug price transparency efforts. The DOH aims to raise awareness of the benefits of the use of generic drugs for its affordability, effectiveness, availability, and safety. It gives the public an informed choice when it comes to their healthcare and empower individuals to take advantage of the cost-saving opportunities offered by generic medications while ensuring their safety and quality.
Sir, ano po yung advice natin, no, sa ating mga consumers na medyo hesitant pa rin sa paggamit ng mga generic medicine? So ano yung masasabi natin sa kanila to switch or to try din yung ating mga generic medicines?
Ayon, so for all the consumers or seeking for health services and treatment, if you're thinking about switching from branded to generic medicines and feeling unsure, here are some helpful information. First of all, generics are just effective as a branded medicines because they have the same active ingredients and meet the safety standards by the FDA. So if you're worried, talk to your doctor or us pharmacists. They can reassure you that generic is a good choice for your needs. So check the label to make sure the active ingredients is the same as the branded version. Plus, generics are often much cheaper, so switching can save more money. Of course, also make sure that generic medicine has FDA approval, which means it has been tested and meets high quality standards. And understanding this can help you confident about choosing generics.
How does the DOH naman po no collaborates with other government agencies such as yung ating FDA para ma-regulate po no or continuously monitor yung ating distribution of generic medicines?
Ayun, so currently po, the DOH and the FDA work together to establish and implement common standards for the quality, safety, and efficacy of generic medicines. So the FDA is responsible for approving generic medicines for distribution in the Philippines, and also they are conducting strict reviews to ensure that these medicine meets the quality standards, while on the other hand, the DOH monitors the distribution and the use of generic medicines in the country, ensuring that they are available and accessible to the public. By working together, the DOH and the FDA ensure that generic medicines in the Philippines are safe, effective, and accessible to the public. The collaboration efforts contribute in providing healthcare outcomes and reducing healthcare costs.
Sir, can you share po ba ating mga highlights po or yung impact na that we saw that generic medicines are helpful po no sa public health natin in the Philippines?
Ayun, so just to share lang sa lahat, one, reflecting to our previous campaign held in 2022 and 2023, we successfully engaged our barangay health workers or BHWs and parent leaders or PL who significantly contributed to spreading awareness about generic medicines. So their participation helped in increasing the utilization of generics in their communities, distributing the pivotal role of their play and advocacy efforts. So marami kaming ginawang mga advocacy campaign for the past few years, including BHW and parent leaders, which is marami siyang nagiging good results since nakascade yung importanteng mga policy po natin, specifically generic medicines. And additionally, generic campaigns and new policies making a positive impact in our health system, leading to improvement and across the country. And as you can see, marami na po tayong mga local manufacturers getting involved, bringing new and affordable generic medicines to the market. This growing embrace of generic is not only expanding options but also strengthening our health system by making quality medication more accessible to everyone.
So far po, ano po yung mga highlight or activities natin that we are conducting for the month of September, especially ngayon po no, we are celebrating or observing the Generics Awareness Month.
Alright, so for this month of September, marami po tayong generic awareness campaign na mangyayari all over the peninsula. And I just hope that everyone can participate as well. Yes.
So lastly na lamang po sir, ano po yung ating message no sa lahat po ng ating mga viewers? And then reminders na lang din po natin for them to take note, especially when buying medicines po.
Alright, so in behalf of the Department of Health Zamboanga Peninsula Center for Health Development, led by our Regional Director, Dr. Joshua G. Brillantes, I want to extend our sincere thanks for this opportunity to promote Generic Month through Kapihan na Zamboanga platform. To all our viewers, I hope that this message reaches everyone, especially those who are seeking for quality medical services and treatments. Please remember that generic medicines are just as safe and effective as the branded ones, but they offer significant cost savings. As we say, generics para sa kalidad na alaga at ginhawang abot kaya. Maraming salamat po.
Thank you very much po, Sir Michael. I'm sure very helpful po yung inyong mga na-share, no, na tips, na reminders, especially in buying your medicines. And yun nga po, ine-emphasize natin parate, no, like what our resource person mentioned po parate kanina, paulit-ulit natin, no, na generics medicines are just as effective as the branded medicine. So, wag po tayong mahihiya, magtanong sa ating mga sa mga local pharmacy stores natin dito sa Zampen or Zamboanga City. Ask po for a generic medicine, no, para makatipid tayo, and of course, safe din naman po itong gamitin. Like yun nga po yung ating ine-emphasize for this month of September for our Generics Awareness Month. So abangan lamang po yung mga future activities or yung mga awareness campaign po na isasagawa po ng Department of Health in Region 9 through their Facebook page at DOH ZPCHD, no, Zampen CHD 9 Facebook page. With that, maraming salamat po muli sa ating panauhin. We have Sir Michael Jumawak, the pharmacist po from Department of Health Region 9. Thank you very much, sir, for this opportunity po. And thank you po sa lahat ng ating mga viewers. Kung meron po tayong mga karagdagan pang tanong, wag po tayong mahihiyang mag-contact po sa ating resource person or sa ating departamento po, no, na kasama natin ngayon sa ating programa. And of course, maraming salamat sa following sponsors. We have Blanca Kalintika Estetica Zamboanga, Dunkin, Penguin, Karimadon, and Kamiseta, all available at SM City Mindpro. Sa ngalan po muli ng Philippine Information Agency Director General Jose Torres Jr. and PIA Regional Director Ms. Noemi Adaga, ito si Myra Espinosa. And see you po sa mga darating pa nating episodes ng Kapihan na Zamboanga sa SM City Mindpro. Muchísimas gracias.
Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on eMedia.